By now, we are all well aware of the many glitches plaguing the Obamacare exchanges. But a new report from the Washington Post today says that major insurers, state health care officials, even Democratic allies warned the president that the exchanges had significant problems. So why didn't the president listen to these warnings and delay Obamacare launch or even the individual mandate? Here now to discuss this, health policy expert Betsy McCaughey, author of the book Beating Obamacare. Why didn't they listen? Why didn't they listen? Their friends were telling them it's not going to work.
It's a mystery. It must have been political desperation because the Government Accountability Office issued 2 reports over the summer warning that the hardware and the software for these 36 federal exchanges were not ready for prime time. The Treasury Department Inspector General warned that the Federal Data Hub, which is like a traffic circle for all the information serving all 50 exchanges, was not ready. It hadn't been tested. That, unbelievable, was not tested until September 30th, the night before the exchanges were going to open. And many industry experts said these aren't glitches, Larry, that these are fundamental mistakes in the design of the software and hardware. Let me give you one example that any woman watching your program will find amazing. If you go on any website, say you're shopping for a new dress, you don't have to enter all your personal information before you see what they have at the Gap or JCPenney or anywhere. But in these 36 federal exchanges, you have to enter all that information about yourself before you can see what plans are offered.
What's the point of that?
Well,
and by the way, they bungled the computers for the personal security. I mean, ID stealing could be rampant in this.
Yes, in fact, that's a major concern expressed by members of Congress and the Inspector General. But here's why they did it, because they didn't want so much sticker shock, so they're giving people the after-subsidy price. Well, to know what the subsidy would be, they have to know a lot about you, how much income you have, how many people are in your family. So that's why they did it. Some of the state exchanges avoided that problem, and there are a few state exchanges that are working well. But the fact is, it's time to press Control-Alt-Delete and delay this because it is not working.
Well, they've already delayed the verification part. So you almost have a free lunch now. People can sign up and get their subsidies. But the weird thing is, you look at some of these states, and I know there's no overall reporting yet. The numbers coming in, not the people shopping around, but the people actually signing up for Obamacare, the numbers are small.
Oh, very small. And let me point out
that
on the doctor and hospital side, doctors and hospitals are also required to use this electronic technology. It tells them what they have to ask their patients, how they have to treat their patients. It standardizes medical practice. And doctors and hospitals are really desperate because they're going to get penalized financially if they don't follow this software. And frankly, the software doesn't work. A lot of it isn't even available yet.
I'm told by some software people that this could have and should have been a fairly routine operation. There's a lot of experts who have said that and can't figure out why it was bungled.
They had 3 years. You know, I think back to Normandy Beach, D-Day. What if they hadn't been ready, Larry?
Right, right.
Government is supposed to be proficient.
So the argument should be made, and maybe at some point Obama will buy it, that the individual mandate should have been delayed.
Yes.
You've already delayed the verification issue. Just delay the whole thing.
You've delayed the employer mandate, income verification, caps on out-of-pocket expenses, and in fact, over half the deadlines in this law. So what you're dealing with now is not really the Affordable Care Act. What the president is trying to impose is a mangled, distorted, illegally changed version
of that law. So I'm just saying, whatever your view is of Obamacare, whether you like it or not, delay it and figure out how to do it right. That's really the thing.
That makes sense.
Betsy McCaughey, makes sense. See, I got that. Now, it's definitely the #1 outrage of the government shutdown.